Hi Kendra, my name is Tressa Burton and I am responding to your discussion post. First of all, I want to say I think that you did a wonderful job. I think you addressed every component of what was asked in the discussion. And I felt like I wanted to respond to your video due to we have the same beliefs as to what we believe are the pros to both virtual nursing as well as the telehealth, and then what we feel are the cons. In my video, I stated how I really felt that the interpersonal and the physicality of the physical assessment for the nurse was lost with virtual nursing, as well as with telehealth, being able for the physician to really be able to connect with the patient in a room atmosphere, being there one-on-one with them. I will state I feel like the pros are the same you had stated for it being able to reach patients that are in rural communities. You also stated for the telehealth being able to help rural areas. Disadvantage, of course, would be technology issues, as you stated. And then I liked how you initiated saying that people would tend to lean towards more apps than instead of in-personal and interpersonal relationships. I thought that was very unique with bringing that to the attention. But as the whole picture, you brought up a good point that in an emergency with telehealth, that if you are seeking something and you, instead of being able to find your provider, you would use telehealth, and it might be somebody that is not familiar with you if you do a over the phone or over an internet connection with a doctor. Some of those facilities provide that. However, I am going to quote from Nelson and Stagger's 2018, the book that we have, Health Informatics and Interprofessional Approach. Increasingly, individuals find it difficult to obtain timely care for urgent health concerns from their healthcare provider. So that is why online telehealth direct care is one growing solution, and the use of video conferencing for telehealth visits is increasing. But I believe that you mentioned as well with what those visits would be best for, would not necessarily be a full-blown initial visit or something that is very in-depth. But also in our book, Nelson and Staggers, it states that in a study, physicians consider telehealth a method for consulting with patients about non-urgent issues or concerning with geographically dispersed patient populations that may not have the nearby access to specialties. The study also found that certain specialty healthcare providers, such as psychiatrists and oncologists, are more likely to use the video conferencing. So I feel that is very much what telehealth should be geared for. And then the more interpersonal relationships with your healthcare provider and doctor's visits could be left for the personal visits as needed. I do feel that there with healthcare, there's providers who haven't yet adopted these tools with technology, and they're realizing that there's potential, and they may be making changes with it. It may help with lowering costs and increasing efficiency, and of course helping with patient satisfaction. So there are goods and there are bads, but I think you did a wonderful job promoting both the pros and the cons, letting the class know about everything, and I really enjoyed your video. So thank you.